Hey everyone, welcome to today's live stream on burnout and stress management, how to recharge and avoid mental exhaustion. So, if you're feeling exhausted, overwhelmed, or you're struggling with work life balance, you're not alone. It happens to so many people. And so, we're going to talk about what burnout really is, how stress affects the brain and body, and most importantly, some practical ways to recharge and avoid complete mental exhaustion. So, before we dive in, just let me know in the chat, have you experienced burnout before? Drop a thumbs up if you can relate. Um, if this is your first time tuning into this channel, my name is Diana, and in this live stream, we'll be covering quite a number of things. One of them is understanding burnout versus everyday stress. So, we'll talk about what burnout really is and how it differs from normal daily stress. Um, we'll talk about the impact of stress and burnout on our mental and physical health. We'll talk about the long term consequences of unmanaged burnout on our well being. We'll talk about the stages of burnout, the early warning signs to watch out for, how burnout progresses and when to take action. We'll talk about some common causes of burnout in school, at work, and in our personal lives. Um, and then I'll also share some effective self care strategies to recharge and prevent burnout. Um, and then how you can set boundaries and manage stress effectively. We'll also look at some practical stress relief exercises and mindfulness techniques. And then at the end, we'll have a Q&A where I'll be answering some common questions and then any questions you might have as well. So this session will be packed with valuable insights, actionable tips, and real life strategies that will help you protect your well being. So please make sure that you stay till the end. Um, so, to start, let me just share a very quick, relatable example of stress and burnout. So, let's imagine that we've got this person, let's call her Barbara. She's a dedicated marketing manager in a huge firm. She starts her mornings with back to back emails, meetings, and deadlines. Barbara is very passionate about her work, but over time, she notices that no matter how hard she tries, the workload never seems to ease up. At first, Barbara brushes it off as normal job stress, and she tells herself, I just need to push through. But as weeks turn into months, Barbara starts feeling really different. So, one, she's constantly exhausted even after a full night's sleep. Her motivation is fading and she no longer feels excited about projects that she once loved. She becomes easily irritated. She's snapping at her colleagues. She's snapping at her loved ones and she feels emotionally drained. She suffers headaches, muscle tension, and even stomach issues, which are becoming more and more frequent. And then she finds herself detaching. So she's no longer caring about work like she used to. Eventually, Barbara burns out completely. She now dreads work every morning. She struggles to concentrate and she feels emotionally numb. And even small tasks feel really overwhelming for Barbara. So now it's not just about having a bad week or a bad day, it's a state of mental and physical exhaustion. This is the reality of burnout. So, what exactly is burnout? Let's look at some detailed definitions of burnout from some recognized organizations. So, the World Health Organization officially recognizes burnout as an occupational phenomenon rather than a medical condition. And it is classified in the International Classification of Diseases as a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. Now, this World Health Organization definition of burnout uses three key dimensions. So, one of that is emotional exhaustion, that's feeling drained, fatigued, and unable to cope. The second one is depersonalization or cynicism, which is an increased mental distance from one's job, feelings of negativity or detachment. And then the third dimension is reduced personal efficacy. So there's a decline in performance, a reduced motivation, and reduced sense of accomplishment. Now, if you notice from this definition, the World Health Organization emphasizes that burnout is specifically related to work and should not be used to describe experiences in other areas of life. Now, let's look at the definition from the American Psychiatric Association. Now, the American Psychiatric Association does not classify burnout as a standalone mental disorder in the Diagnostic and Statistical Manual of Mental Disorders. However, what it does is that it acknowledges burnout as a psychological syndrome emerging as a prolonged response to chronic interpersonal stressors on the job. Now, according to the American Psychiatric Association, burnout can manifest as emotional and physical exhaustion. Similar to the World Health Organization, it can also manifest as cynicism and detachment from work, and a sense of ineffectiveness and lack of achievement. Now, what they highlight from the definition of burnout is that it's often linked to workplace stress, but it can also contribute to anxiety, depression, and other mental health issues over time. Now, from a psychological perspective, a leading researcher on burnout described it as a state of emotional, physical, and mental exhaustion caused by excessive and prolonged stress. Now, it identifies this definition is by Dr. Christina Maslach, who is a leading researcher on burnout and who co developed the Maslach Burnout Inventory, which is one of the most widely used tools to assess burnout. Now, this tool identifies three primary components of burnout: exhaustion, which is feeling drained and overworked; depersonalization, which is developing a negative attitude towards work or people; and reduced accomplishments, which is feeling ineffective or unproductive. Now, she argues that burnout isn't just about working too much, it's also about feeling disconnected from your work, lacking control, and being unsupported. Lastly, I want to look at definition from the National Institute for Occupational Safety and Health, and they define burnout as a prolonged response to chronic stressors in the workplace, leading to physical, emotional, and behavioral symptoms which impair work performance and personal well-being. And they also emphasize that burnout can increase the risk of serious health issues, including depression and anxiety, cardiovascular diseases, weakened immune function, and then sleep disorders. Now, what you would notice with all these definitions is that they vary slightly, but what they all agree on is the fact that burnout is a serious condition that is linked to chronic stress. Um, it's primarily in the workplace and it affects both mental and physical health. And if left unmanaged, it can lead to long term psychological and physiological consequences. So, in summary, burnout is not just about being tired, is a state of exhaustion that affects your ability to function. So, now, what's the difference between burnout and stress? Stress is short term, whereas burnout is long term exhaustion caused by unmanaged stress. Now, stress might make you feel overwhelmed, but still quite hopeful, while burnout makes you feel hopeless, numb, and detached. And unlike everyday stress, which comes and goes, burnout builds up over time and drains you completely. So, I'm going to share a few statistics on burnout and stress. One study found that about 76% of employees experience burnout at some point in their careers. And then the American Psychological Association reports that 70% of adults feel overwhelmed by stress at least once a week. So, burnout has different types, and some of them include work related burnout, which is as a result of feeling overworked, undervalued, or even stuck in a toxic job, in a job that you don't like. We also have emotional burnout, which arises from supporting others while neglecting yourself. And this is very common in caregivers and teachers and some other professions. We also have creative burnout, which is losing passion for hobbies or work due to exhaustion. And then there could also be decision fatigue, so feeling mentally drained from constant decision making. So now that you've heard about these different types of burnout, um, which type of burnout do you think affects you the most? um, Pop that in the chat. Let's learn from each other. So next, let's talk about the impact of stress and burnout on mental and physical health. Now, burnout and prolonged stress don't just make you feel exhausted; they can have serious effects on both mental and physical well-being. Now, let's try to break down exactly how stress and burnout affect different aspects of our health. Now, the first part is, how does it affect our mind? How does it affect our moods? How does it affect our bodies? First is the mental and emotional impact, which is increased anxiety, depression. Chronic stress has been shown to disrupt brain chemistry, so leading to persistent worry, panic attacks, or deep sadness. Also, it can lead to cognitive decline. So, prolonged stress affects our memory, it affects our focus, it affects our decision making, and it makes it harder to concentrate or even retain information. There's also emotional exhaustion. So you may feel emotionally numb, detached, or easily irritated. And this usually happens in situations that normally wouldn't bother you. And then there's the loss of motivation, um, which is characterized by feeling overwhelmed about tasks that once excited you, and then you might even begin to feel those tasks might begin to feel meaningless to you. So let's give an example. Just imagine working long hours without breaks. Over time, you will start to feel mentally drained, you will start to feel forgetful, and then you will begin to feel anxious about even the smallest tasks. You might even begin to snap at your loved ones, your friends, your colleagues without even realizing why. Now, in terms of the physical impact of burnout, um, we burnout can affect the immune system. So it weakens the immune system, lowers immunity, making you more susceptible to things like colds, infections, and even some autoimmune diseases. Um, it can also lead to heart problems. So, long term stress can increase blood pressure and inflammation and raise the risk of heart attacks and strokes. Um, Burnout can also manifest physically in the form of digestive issues. So, stress affects gut health, leading to problems like nausea, acid reflux, irritable bowel syndrome, and even appetite changes. There could also be sleep disturbances. So, burnout can cause insomnia or sleep that is not refreshing, leading to constant fatigue. And then you could also have chronic pain and muscle tension. So, stress has been found to cause tight muscles, headaches, back pain, and an overall sense of physical discomfort. So, a typical example could be you're so stressed that you begin to have stomach aches, or you begin to have headaches, you're throbbing headaches, or you just can't sleep. That's your body reacting to prolonged stress overload. Now, these issues can have this impact of burnout can have long-term consequences on our well-being when they are not managed. And so if burnout isn't addressed, it can have really serious long-term effects, which include mental health consequences. We've mentioned before severe anxiety or depression. So, if left unchecked, stress can escalate into clinical anxiety or depression, which will then require professional intervention. There could also be emotional numbness or disconnection, detachment. So, burnout can make people feel emotionally drained, disconnected, or even cynical about work and their relationships. And then there's the loss of identity and purpose. So some people just lose interest in things that they once loved, and they just feel like even when they are doing them, they're just going through the motions. So a typical example of this could be like a high achieving student who's been pushing through exhaustion for months and months on end just to maintain good grades, and eventually they get to a point where they lose motivation entirely. They feel numb and they feel disconnected from their goals. In terms of physical health consequences, there could be chronic fatigue syndrome. So, long term burnout can lead to persistent exhaustion even after rest. So, you have enough sleep at night, the recommended 7 to 9 hours or even more, and then you wake up still feeling exhausted. There could also be issues with high blood pressure and heart disease. So, like I said before, it's linked to an increased risk of heart problems and cardiovascular diseases. Um, it can cause autoimmune disorders and inflammation. Stress can trigger inflammatory conditions like arthritis and lupus. And then the poor sleep patterns as a result of burnout and stress can become permanent, increasing the risk of other health issues. So it's just like busy professionals who ignore signs of burnout for years, eventually developing high blood pressure, developing things like frequent migraines, and even severe insomnia. And that's why it is really crucial to manage stress and burnout, because they don't go away on their own. If left unmanaged, they can take a permanent toll on the mental and physical health. And so that's why it's also essential that the signs are recognized early and action is taken as soon as possible. So, in order to recognize burnout early, we have to know that it doesn't happen overnight. It actually develops gradually over time. And so, by recognizing the early warning signs, you can take action before it becomes overwhelming. So we're going to break down burnout into a couple of stages. Some literature will tell you there are 7 stages of burnout. Some other literature will tell you there are 5. Some will tell you there are more. But for the purpose of this live stream, I'll just break the stages of burnout into 4, um, and then tell you how to identify them and possibly what to do at each stage. So at first, burnout can feel like regular stress, but over time, it intensifies and begins to affect every aspect of your life. So before we go into the stages, let's talk about some early warning signs. So it could be physical signs like constant fatigue, headaches, muscle tension, difficulty sleeping, frequent colds. It could be emotional signs like feeling overwhelmed, anxious, or detached from things you once enjoyed. It could be cognitive signs like trouble focusing, forgetfulness, decreased productivity, making more mistakes than usual. It could be behavioral signs like procrastination, avoiding work or responsibilities, withdrawing from social activities, or relying on caffeine and sugar to push through. So, the burnout unfolds in stages, and I mentioned earlier that I was going to talk about 4 stages. And the earlier you catch it, the easier it is to reverse. So, the first stage I'm going to talk about is the honeymoon phase. So, let's say in this phase, you're excited about a new project, a new job, or a new responsibility. You're working quite hard, you're taking on extra tasks, you're feeling really motivated. Your stress levels may rise, but you push through believing that you can handle it. Now, at this stage, you might not have recognized that burnout is starting to creep in. But what you can do at this stage is try to establish healthy work life boundaries early on. Don't overcommit and make time for rest. The next stage is the onset of stress. So, in this stage, let's say your workload increases and then the stress starts to feel more constant. So, you're beginning to feel tired more often and your productivity may start slipping. So, you notice minor physical issues like headaches, trouble sleeping, or stomach discomfort. Now, what can you do at this stage? You can recognize these stress triggers in your life. You can take breaks, you can get enough sleep, and then you can start setting boundaries before the stress escalates. The next stage is chronic stress and fatigue. Now, at this stage, you're beginning to feel drained all the time, even after rest. You may develop physical symptoms like back pain, migraines, or frequent colds. Your work and daily tasks might begin to feel more frustrating than rewarding. You develop you're irritable, you're anxious, emotional numbness sets in. Now, a typical example is, let's say from the beginning you used to love your job, but now every task feels really exhausting. You wake up, you're dreading work, you have trouble focusing, and then you find yourself avoiding social activities. Now, this is a very critical point, and if you don't step back now, burnout will fully take over. So, what you can do at this stage is to try to reduce unnecessary commitments. You can try to practice stress management techniques, and you could also begin to seek support. Um, the next and final stage I'm going to be talking about is full burnout and exhaustion. Now, at this point, the mental, emotional, and physical exhaustion is now extreme. You may feel cynical, you may feel detached, you may feel hopeless about your work and your personal life. At this point, depression and anxiety and other chronic health issues can develop. Your productivity plummets, and you may feel unable to continue. You may feel disconnected from your job, your family, your hobbies. You have no motivation whatsoever. You're constantly exhausted, and even the smallest of tasks feel impossible for you to carry out. Now, at this stage, serious intervention is needed. You may need a break, you may need some professional help, or you may even need a lifestyle change to recover. So at this point, seeking therapy, coaching, or medical advice can help you to rebuild your balance. Now, if you recognize early signs of burnout, my advice would be don't ignore them, because the earlier you take action, the easier it is to recover. And if you're at an advanced stage, please prioritize your health, because burnout isn't going to fix itself. Now, let's just go over some common causes of burnout in work, in school, and personal life. Now, burnout doesn't just happen randomly. So it builds up due to ongoing stressors that drain your mental, emotional, and physical energy. Whether it's at work, whether it's in school, whether it's in your personal life, certain patterns make burnout more likely. And so we're going to just explore a few of the biggest stressors that lead to burnout. Now, it's usually caused by a combination of stressors rather than a single event. And some of them include, as regards work, unmanageable workload. So, too much work and not enough time or resources to handle it. It could be lack of control. So, let's say you feel like you have no say in decisions or how you do your job. Also, unclear expectations. So, constantly shifting responsibilities or unrealistic performance goals at work. And then a toxic work environment. So, if you work in an environment where there's a culture of negativity, a culture of micromanagement, or lack of support, and then also work life imbalance. So always being on and unable to fully disconnect from work. So let me give a typical example. Let's say you start staying late at the office to meet some impossible deadlines. At first, you think that it's probably going to be just temporary, but months pass and the pressure never lets up. Soon, you're always exhausted, and then you're beginning to dread each work day. Now, in terms of the school related stressors, it could be academic pressure, so constant exams, assignments, and the fear of failure. It could be overcommitment, so taking on too many extracurricular activities or part time jobs. It could be perfectionism, so feeling like anything less than an A plus or an A is a failure. It could be lack of breaks, so studying nonstop with little time for rest, self care, or hobbies. It could be social and peer pressure, so you're trying to fit in while managing academic stress and other life stressors. So, let's give a typical example. Let's say you're a nursing student, you're juggling classes, you're juggling a part time job, you're having to, you're occupying leadership positions in some clubs or associations, and you begin to push through exhaustion, believing that rest is probably a waste of time. Eventually you will struggle to focus, you will lose interest in those activities that you once loved, and you will feel constantly drained. Then in our personal lives, stress and burnout can show up as family or relationship conflicts. So, constant emotional strain from unresolved issues. It could come from financial stress, so struggling to meet expenses or feeling trapped in debt. Um, it could be caregiver burnout, so you are the one taking care of children, or you're looking after elderly parents, or you're providing care and support for a sick loved one without enough support for yourself. It could also be lack of personal time. So you're always prioritizing others over yourself, leading to exhaustion. And it could also be that you're dealing with some chronic health issues of your own. So you're dealing with long term illness, pain, or fatigue. So let's give an example. Let's say you're a parent, you work full time, you're managing household responsibilities, you never take a break, you're always putting your family's needs first. Over time, exhaustion will begin to set in, and this can lead to resentment, it can lead to mood swings, and it can also lead to a sense of losing yourself. Um, and also, I feel like high achievers and perfectionists are more at risk of experiencing stress and burnout. People who are highly driven and self motivated often struggle with burnout more than others. Why? I think it has to do with the fact that they push themselves too hard. So they set extremely high expectations and they refuse to slow down. Um, High achievers and perfectionists also struggle to say no. So what they do is they take on too much, believing that they should handle it all. And then also they could tie their self-worth to their achievements. So their identity might revolve around success, making failure feel really devastating. And I think as a result of all of these things, they may ignore the warning signs of burnout and stress and just assume that exhaustion is just a normal part of hard work. And lastly, I feel like um, these individuals might find it really difficult to ask for help because they see rest, assistance, or asking for help as a sign of weakness. So, a perfectionist employee, for example, might never say no to extra projects. They'll feel like when they say no, they'll be disappointing their boss. So they'll stay late every night, skip meals, refuse to delegate, and eventually their performance begins to drop. They feel emotionally numb and then they start to resent their job. So, what are the key takeaways from this section? It's about avoiding burnout before it starts. So, recognize that what your biggest stressors are at work, at school, or in your personal life. Set realistic expectations for yourself. Perfection is unattainable. You can learn to say no and create boundaries that protect your time. You can prioritize rest and self care just like any other responsibility. And then, if you're feeling overwhelmed, you can seek support before burnout fully takes over. Now, in the next section of this live stream, we'll discuss some science backed strategies to recharge and prevent burnout. Um, if you've been watching this live stream up till this time and you're getting value from it, please make sure to hit the like button and share it with people who might benefit from it. And if you haven't already, please subscribe to the channel and turn on the bell notification so that you don't miss out on future content. So, let's talk about some effective self care strategies to recharge and prevent burnout. Like I mentioned before, it will not just go away on its own. It requires intentional recovery and lifestyle changes. So if you're feeling mentally and physically drained, um, there are some science-backed strategies and simple self-care habits that can help you recharge and prevent burnout. Um, and note, it's not just about taking a short break, it's about actively restoring your well being. Um, and so, what research has shown is that these strategies can help rewire your brain. Um, so, you can do that with rest and recovery. So, prioritizing deep rest and sleep. Now, sleep isn't a luxury, it's a necessity. And there have been studies that have shown that sleep deprivation weakens our emotional regulation and increases stress. Now, what chronic stress does is that it disrupts our sleep cycles. So, what you can do is to focus on a consistent sleep schedule, even on weekends. You can reduce screen time before bed to improve melatonin production. You can practice relaxation techniques before sleep, such as deep breathing and meditation. So, for example, instead of scrolling on your phone until midnight, why not try reading a book or doing a 5 minute meditation? Doing this over time can improve your sleep quality and reduce stress. Um, the next way you can reduce stress hormones is with physical activity, and exercise is one of the best stress relievers because it lowers cortisol, which is the stress hormone, and it increases endorphins, which are the feel good chemicals in our brain. So you can aim for about 30 minutes of movement daily. So it could be walking, it could be stretching, it could be yoga. And if you're exhausted, gentle movement, like a short walk, is better than nothing. Studies have found that even 10 minutes of walking outdoors can significantly reduce stress and improve mood. You can also reset your nervous system with mindfulness. Mindfulness and meditation help lower anxiety, and and helps prevent emotional exhaustion. So you can try guided meditation apps like Headspace or Calm. You can try breathing exercises like box breathing, which can instantly reduce stress. And when overwhelmed, for example, you can try this breathing technique. You inhale for 4 seconds, you hold for 4 seconds, you exhale for 4 seconds, and you hold for 4 seconds again. You could repeat this about 3 to 5 times. And what it does is that it signals your brain to relax. Some other simple self care habits that can make a huge difference. So, self care in this instance isn't just about having bubble baths and spa days, it's about intentionally creating sustainable habits that will protect your mental and emotional health. So, one of those things is to set boundaries, to learn to set boundaries and say no. Now, burnout happens when you overcommit. So, you need to learn to set limits at work, school, and in your relationships. So, a typical example of a work boundary could be don't check your emails after work hours. In terms of social boundaries, you can say no to plans when you need rest. And then for personal boundaries, you can prioritize alone time without feeling guilty. So establish those clear boundaries and stick to them. You can also schedule guilt free breaks. Um, and taking breaks doesn't mean that you're lazy, it actually makes you more productive. So there's a technique that you can use called the Pomodoro technique. You could work for 25 minutes and then take a 5 minute break. So step outside for some fresh air or do a quick stretch break. Um, you could find a hobby unrelated to work. So it could be painting, it could be playing an instrument, or it could be doing some puzzles. Studies have shown that taking short breaks improve your focus and reduce mental fatigue. You could also work on your nutrition for stress management. So, foods like dark chocolate, green tea, and omega-3 rich foods have been shown to lower stress hormones. Also, you can try managing your expectations and letting go of perfectionism because, like I said, perfectionism has been linked to anxiety and depression. So a pro tip is to aim for progress, not perfection, because done is better than perfect. So you've done something is better than doing it perfectly. So you could just aim that to make progress rather than doing things perfectly. You could stay connected and ask for support. Social support is a powerful antidote to burnout. So, talk to a trusted friend, talk to a mentor, talk to a therapist. You could join supportive communities online or in person. And most importantly, don't be afraid to ask for help whenever you need it. Research has shown that people with strong social connections recover from stress faster than those who isolate themselves. So now that I've shared some of these science-backed strategies and self-care habits that you can use to reduce your stress and burnout, which of these self-care habits do you already practice? Please share in the comments or in the chat. So your key takeaways from this section in terms of your burnout recovery plan is to prioritize deep rest, is to move your body daily. Um, Remember, sleep is your brain's reset button, and even light movement helps reduce stress. Um, Ensure that you have good nutrition, you practice mindfulness, you set boundaries and protect your energy and say no when needed. You take breaks guilt free, and then you lean on support because you really don't have to do it alone. Now, remember that preventing burnout isn't really about doing more, it's about doing what truly matters for your well being. Now, just as we're about to round up, we'll take some common questions um, about burnout and stress. So, one of the common questions that um, has come up frequently is how do I deal with burnout if I can't take time off work? Now, if taking time off isn't an option, I suggest focusing on small daily changes to prevent burnout from getting worse. So it could be just about setting boundaries, like we've said, protecting your time by limiting work that is done outside of work hours, saying no to extra tasks, you know, taking micro breaks. Those short 5 minutes breaks can help reduce stress. So you can step outside, you stretch, do some deep breathing. You can prioritize your tasks so you focus on high impact work and let go of the need to be perfect or perfectionism. You could engage in some self care outside of work, so prioritize sleep, healthy eating, and activities that recharge you. And most importantly, lean on support. So you talk to your mentor, talk to a colleague, talk to a therapist for guidance. The next common question um, is what's the best way to reset after burnout? So remember that burnout recovery is not instant, but these steps can help you to recharge effectively. So the first step is to identify the root cause. So what's causing this burnout? Is it your workload? Is it a lack of boundaries? Is it emotional exhaustion? The next step is to slow down and try to reduce the stress. So you can prioritize use the self-care activities that we've mentioned and engage in low effort activities. The third step is to restore your energy. So you would want to engage in activities that bring joy, such as exercise, your hobbies, and some social time. um, the next step is you can create a sustainable routine. So gradually reintroduce work with better boundaries and self-care habits. um, if burnout leaves you really exhausted, you can start by improving your sleep and nutrition before jumping back into a full workload. Another example could be if you can't take a full vacation, you could schedule small recovery moments during your day, during your week, like a quick walk, deep breathing, or listening to music in between tasks. And then the third most common question is, how do I know if I need professional help for stress? So, if your stress is severely impacting your life, your daily life, seeking professional support is actually a wise step. And some of the signs that you may need help include that constant exhaustion that doesn't improve with rest and enough sleep, um, the persistent anxiety, the persistent sadness, the irritability that is affecting your mood and your relationships. Um, you could also need professional help if you begin to have trouble sleeping, or you are beginning to use substances like alcohol and caffeine to cope. Also, where there begins to be a decline in performance at work, in school, or in your daily tasks, then you know that you might need professional help. And then physical symptoms like headaches, digestive issues, or frequent illnesses. For example, if stress has made it almost impossible for you to concentrate at work, concentrate at school, if it has disrupted your sleep, or it has caused panic attacks, a therapist can help you develop some coping strategies. And um, burnout isn't just about needing a break, it's actually a sign that something needs to change. Something needs to change. So even if you can't take some time off, some small adjustments to your lifestyle can make a big difference. And like I've mentioned before, if it's becoming overwhelming, don't hesitate to seek professional guidance. So, to recap, burnout isn't just about being tired. It's actually a serious mental and physical health issue. Um, Prioritizing rest, setting boundaries, and practicing self care are essential. Um, Seek support. Burnout isn't something you have to deal with alone. So make sure that you lean on your social circle, you lean on a friend, family member, a mentor, colleagues, or even a qualified mental health professional, um, to deal with the burnout and stress that you may be experiencing. Um, at this point, I want to reiterate that if you have found this live stream helpful, don't forget to like, share, and subscribe for more content on mental health and well being. And please also don't forget to turn on notifications so that you don't miss future content, videos, and live streams. And remember, just my final thoughts, burnout doesn't mean that you're weak, it actually means that you've been strong for too long. So please take care of yourself, and I'll see you in the next video.